Welcome everybody back to our town hall. I hope there's no town hall fatigue yet. I guess there's a little screen fatigue, and I welcome everybody that's here. And just to reiterate, all of our town halls are recorded, edited, and we take away all the outtakes, I guess, and we put them up on our website. So P. Hopkins MD, Hopkins Medical Group, you can refer, repost, and listen to anything that you might have missed as we go through the updates with regards to where we are as a practice, where we are as a state, where we are as a country, and we will touch upon things we know and look at all that we do not know yet. So things remain in flux, and I do not think we have a clear path over the next 3 months, but every day it is changing the information we're relying upon. So with that, I'll refer back to Ted to kick off what we're going to talk about tonight.
Thank you, Pat. I'm Ted Canova, and I'm the host of Pat's Genius of Wellness podcast that we hope that you are downloading and listening to. In this town hall, once again, we're going to be joined by Dr. Steve Roberts and functional nurse nutritionist Leslie Frodema. And we had talked off camera last week that, boy, remember all of those New Year's resolutions we made? Well, they got sidetracked because we went into quarantine for 3 months. So we think that right now is the time to press reset. And what better way to press reset than to learn safe and simple ways to detoxify your life, detoxify your body, everything from stress to nutrition. So in the next half hour or so, we're going to be addressing those methods, and we're going to be taking your questions. The goals today is that we're going to talk about the updates at the practice, since Pat and her team are slowly opening up their doors for more and more hours each week. We'll have a status report on Massachusetts COVID cases. As I said, we're going to go deep into detox, what you need to know, plus answer your questions. As we've said in other town halls, once the coronavirus struck, Pat and her team quickly mobilized and did in 1 week what most organizations took a month to do. And they created a telemedicine portal. And for months now, dozens upon dozens of patients have been getting their telemedicine appointments. They've been having physicals. It's been very, very successful. It is the foundation of the core service that has been happening during this COVID crisis, and it will continue as the doors open. Telemedicine, as you know, offers scheduling convenience. It's Monday through Friday. There's no waiting. Many insurers are waiving fees and deductibles, and it's great for new patients, physicals, follow-ups, and refills. Pat, the office is opening on a limited basis. Why don't you share how it's opened right now?
So we continue to focus on the fact that social distancing, masks, hand washing, and cleaning each room in between each patient. So having said that, our waiting room, we're limiting it to 4 patients to be in the waiting room. We prefer that you call us from your car when you arrive. And if there are 4 people in the waiting room, we will ask you to wait in the waiting room, and we will call you to come directly into the room when it's available. We are doing injections, infusions, and exams as necessary on Tuesday, Wednesday, and Thursday. Will be in the office starting next week, all day Wednesday and Thursday, and doing telemedicine Monday, Tuesday, Thursday, Friday. Mara is there she is now in Tuesday all day and Thursday all day. Leslie is assisting me on Wednesday, and Steve is at the hospital as a hospitalist, but we will be expanding those hours as the summer rolls forward to a 5-day-a-week schedule. Having said that, I think that people are seeing that there is value in continuing their telemedicine visits, and the convenience of it is that we can obviously not interrupt your life and your schedule with work. people have been asking me today. I got more questions about when are we going to be doing our aesthetics. So that'll start next week as well. Thursdays, Mara and I will be doing the aesthetics with Botox and fillers. And the Beamer is back in town. So that we're going to open up the Beamer for those of you that were using it and really finding it beneficial. Monday and Friday will be our Beamer and laser day, because there are a lot of people that were in a laser program for Lyme, for joint pain, for infections. In fact, I think going forward, we're going to probably be able to offer a laser program for preventive infections as we delve into how to support ourselves going forward in the new era of viruses. So I see Monday and Friday as our treatment days for those therapeutic modules. So we will be announcing the availability of all these as time rolls forward. So we're opening up and getting back in town.
As we're opening up, so is the state, as everybody could tell. And we wanted to go through the Massachusetts stats because there were some interesting things that Leslie and I discovered yesterday looking at the dashboard by the state of Massachusetts and the Department of Health. So far, there are 103,000 plus cases in Massachusetts. The cases alone, the average age was 52. Those who are currently hospitalized, the average age is 68. And amongst the deaths of the 7,300 plus, the average age is 82. Pat, would you speak to this a little bit?
Well, I think there are a few factors that are involved. As we age, our metabolic risk becomes higher because we are further along in the pathway of hypertension, obesity, diabetes. The second one is proximity. There are a number of families living together. And so there's a density so that's why you see Suffolk County high. And I think age is the risk for anything. If you look at any disease that comes with age, so comes the risk for viruses. In fact, when the influenza vaccine was first launched, it was for people over 65 because they were the high risk, and that follows with any virus that we see.
Interesting. Steve, I want to turn to you because you are working in an area hospital and you have treated COVID patients. A report that came out yesterday was that the shutdown prevented 60 million cases of infection in the United States. There were two different studies. The study said that the disease was spreading at an extraordinary rate. Without the shutdown, 60 million more infections would have happened in the United States, 3 million more lives in 11 European countries. And these reports warn of the second wave that we're far from herd immunity. I'm sure you're not surprised because you've been working in the hospital to see the impact on the shutdowns, but would you speak to this for a second?
It's tough when you have just a single study, and probably most of the people who are listening now have even had the experience of, well, we said as a medical body, we said one thing a month ago, and then 3 weeks later, we said something new and different based off of new study data. And that's unfortunately a common thing we see in medicine, that we get studies that will kind of refute and negate what's said all the time. And so we have to kind of take all these things as a whole in a general picture of what is this trying to tell us. But as a whole, I do think we've slowed down the rate at which people have gotten exposure to the virus. And if you remember back to the very beginning, the goal wasn't to decrease the total number of people who got exposed. It was to just kind of slow it down so that hospitals wouldn't become overburdened. And we were fortunate in Massachusetts, and I will say in our hospital, we never reached a point where we were exceeded beyond capacity, that the people couldn't be put on a ventilator who needed to be put on a ventilator. And so we were fortunate in that we didn't have to have some of those same challenges that the people in Italy faced. But there's some things in this that I don't necessarily like the tone of, and that is it's okay for us to be prepared and to be thinking forward to the future, but I don't want it to be alarmist, about this idea that, we're going to get hit again and we're not ready yet. And I think it's okay to be speculating about those types of things and what we should be doing to prepare. But And in my view, the best way to prepare is to actually be doing things to support your own immune system. Before we started the webinar, actually, we were all discussing, the role of vitamin D, and how it's been fairly well demonstrated that the people who seem to have the highest degree of significance with the severity of their COVID-19 disease are those who actually have a vitamin D level that's less than 30.
We like 60. So that number, I will tell you where the number comes from, which is the mathematical modeling. So 20% of the population, so let's just give our guesstimate of the United States, is between 350 and 400 million. That puts 70 million people they're the risk population. So if we're only at 1 million people, 1 million to 2 million, you can safely say, any of us could say, well, the shutdown saved those 68 million people that might have gotten infected. I think that I do recommend people look up Frisk's, Frisk, and his data modeling out of the University of Cambridge in London. And he's a neuroscientist looking at what he calls the things that we look at in the universe, which we call dark matter. He said immunologically, we have dark matter, and it's understanding that'll allow us to look into how we handle the future.
Well, as we talk about the future, this is the juicy topic. How do you decide when it's time to re-enter society? And I'm going to open this up to the three of you.
Well, I will just say, for my immediate family, I am not social distancing. I am seeing my family in my home, not out in the driveway. We have all been isolated for the last 12 weeks, and therefore I am feeling comfortable. First. Second, I keep my vitamin D level at 60. I take precautions. I use the herbal throat sprays. I am now using hypertonic saline lavage on a regular day when I'm ever out of the house and going beyond people that I see on a regular basis. And I think there's a lot that we can do that will make it reasonable. We're not going to, think about it. Are we going to send children to school with face shields? Are we going to eat in a restaurant and the servers and everyone will be wearing masks? And how long will that go on for? The typical model of sick, exposed, infected, and recovered, the SEIR, which is how we follow diseases. It's not as easy to apply in this case because we don't have enough information on the viral load it takes to become infected and then perhaps sick. And we don't know, again, the asymptomatic level. How contagious is the person asymptomatic? I'm a little more lax. My husband's very strict about washing everything, and I'm strict about spraying everything. So I kind of spray myself all the time.
Leslie, why don't you share with us, when is the right time to enter society?
Well, I think it is important to try to follow the guidelines that the state's putting out as much as possible and continuing to phase things in. But I know in our house, we just had a conversation about, can my 15-year-old daughter start going to gymnastics again? So her gymnastics center opened on Monday. And we had a discussion, and my husband really thought we should wait a couple weeks to see what happens. And I said, well, if everybody takes that attitude, nobody's going to show up because we're all waiting to, kind of see what happens. I think for us, we feel like, as Pat did, that we have stayed within our little cocoon of our family and that we're beginning to venture out more, but we're doing it in a safe way with hand washing, with using masks. We're not really using gloves, but we're trying to still exercise good judgment, but to kind of put our toe in the water and start kind of testing the waters about getting out of the house and expanding a little bit.
Leslie, you've got a teenage daughter. Pat, your kids are grown. However, you have been living with the grandkids there. Steve, you're in the unique position that you've got a little baby. So when do you and your family decide to re-enter society?
It's an interesting question, Ted. In fact, my boy and his mom are actually visiting her mom and dad in Vermont right now. So they've actually just branched out. Vermont had a lower caseload than here in Massachusetts, so they're a bit further ahead and the concern's probably a little lower. I think it's important for us to maintain some perspective in that the vast majority of people who have gotten this virus actually do quite okay with it. You know, maybe don't even have symptoms at all, have minimal symptoms, do not have a high or significant disease burden. I'm not trying to say that there aren't people who haven't had some fairly devastating occurrences from it, but it's important to remember that the majority who get it do not. And in that respect, it's actually not all that dissimilar from a lot of other viruses and things that we get from day-to-day living and that our kids would get at the daycares they go to, or with all the other kids running around with what snotty things are in their nose. And when we talk about this risk of a potential second wave that we need to be concerned about, you know, I do think there is value in thinking about that term that you brought up earlier, Ted, which was that herd immunity thing. If we're going to get herd immunity, you know, people are going to need to actually get the virus and develop antibodies to it. They're going to have a robust immune system if we want to see a smaller second wave or smaller spike. And so I do think it's a very individual case-by-case situation. I do think it's important that we respect the wishes of the other people who we might be visiting. And so if you have an 80-year-old relative who has a lot of fear about getting it, I don't want to exacerbate their fear by being very carefree and nonchalant about this. You know, I want to make sure I'm respecting their wishes. But apart from that, I would say that I have become much more relaxed in my attitude. And I would say, you know, considering the vitamin D thing and all of the other things we know about the benefits of nature and being outside, we all need to at least, if not entering society in terms of like going out at night life in the city, we should at least be going out into society and having our walks in nature and interacting with the world around us, at least in that respect.
Thank you for that. We have some questions coming in. Thank you. Kim asks, first of all, she hopes everybody is doing well, and we could tell that everybody is looking good. She has a question about COVID and autoimmune conditions. She's been able to work from home since March, but her employer is now talking about plans to return to the office. Her question is, do autoimmune conditions qualify as an at-risk underlying medical condition that would warrant a workplace accommodation to continue working from home?
So I will take that because I get that question every day. And I think that it depends. And it depends on the level of autoimmunity. So we take care of a number of people with everything from rheumatoid arthritis to scleroderma to Hashimoto's to Crohn's. And I think that you have to address what medications they're on, what their rate of infection and risk of infection. So if you have pulmonary disease, we're going to say yes. If you have interstitial lung disease, if you have compromise of your pulmonary vasculature, this is putting you at a higher risk. Not all of the autoimmune diseases put you at a high risk. So those are the things that I recommend and also on also your work side, how is work addressing going back? Are they doing shifts? Are they cycling workers coming back into the office so that people are adequately spaced so that everyone's not crowded? So we know crowding is an issue. Exposure to people that don't know they're sick, we might be an issue. And aerosolizing, and depends on the ventilation in your building. Can you open a window, or are you in a closed loop HVAC system?
Well, this is all so new, as we know, and workplaces are trying to figure it out. So this is the time to kind of raise your hand and raise those issues with your HR department.
Ted, I just want to stop there for 1 second before we go to the detox. One patient did write in and asked, am I putting other people at risk by being in the office and seeing patients? And am I also putting my family at risk by seeing patients? And I would like to say that right now we wear separate, different clothes. Each mask and our clothes are washed, set, and 72 hours between use, a minimum, so that nothing gets repeated coming into the office or carried out of the office. I use the herbal throat spray, the hypochloric acid on my face, obviously hand washing, sterilization. We have a small ozone generator, so it generates ozone in the hallway. We are trying to keep everyone safe who comes into the office as much as I'm keeping my family safe from me being in the office. And it just like Steve's at the hospital, and maybe you can talk for a minute about you leave the hospital where you're taking care of COVID patients, what's the risk you put your community at?
So when we were in the surge, I would go to the hospital wearing the clothes, and I used my car as like a quarantine zone, essentially. I ran out to my car in the early hours of the morning, pretty much in my underwear, put on my clothes in the car, went to the hospital, came back, took off my clothes in my driveway, and ran into the house in my underwear. So I'm sure some of my neighbors were.
I was forbidden to do that.
Yeah.
All to do that.
Steve, if only we had old-fashioned phone booths, you would have looked like Superman.
Yeah, much less defined and sculpted physique, unfortunately. So the one of the things I will say, the reason I did take those extraordinary measures, one was because, I don't if you'd call that extraordinary, but was because, one, we were in the height of what was going on. So my concern was greater that I didn't want it to be that time that a family member would get sick. And secondly, I do still have some concern about different strains of this virus, and that those that are maybe from people who were so severe that they needed to be in the hospital could potentially be stronger strains. Now, we don't really have a lot of evidence or data, and people aren't really researching that significantly to a degree. But when I think about how, if I'm going to get this virus, how I would like it to be, I would like it to be from the people who are asymptomatic. So again, the concern that I have out there is, you know, if I'm gonna get it, I'd like to get it from the person who thinks they're healthy, walking around outside. And you know, that's the way that I feel about it now at this point. I don't think that this is like an established highlighted way of doing things, but I did hear one person talking about how they thought we should reintegrate into society, and I really liked the idea. Was that when we've talked about how we integrate, it's not just about when we do it, but how. And his suggestion was, if you reintegrate, expose yourself for 4 days. Like, you go out, you're working, but then give yourself like another week off, because we know the symptoms would come if you're going to get sick in the next 7 to 10 days. And so if you're exposed for 4 or 5 days, then take a break for a week. And that way, if you do get sick, you're not going to then further promote and spread it to other people around you. And so I do kind of like that idea of dividing people into a segment of like a group A and group B, and people are 1 week on and 1 week off, and then they come back. But, you know, that's a strategy that you could consider employing with how you do it in your life and with the people around you.
I like that. And just as a footnote, I think the CDC is going to come up with the recommendation that we should re-enter society running around in our underwear in our cars. But that would be quite a thing to hear elected officials talk about, I think.
Every once in a while they say something crazy, so who knows?
Oh, you think only every once in a while?
Yeah, I think it's a little more frequently than that.
Well, let's move on. Like I say, we started the year with such high hopes, and then this all happened. And, you know, we've eaten more bread probably. I know a lot of people have been cooking a lot more bread, and, you know, our diets have kind of changed, and the comfort foods we bought have changed, and maybe the activity and the exercise has changed. We were coming off of winter, and all of those high hopes kind of got stalled for many, many people. So we thought, well, why don't we press reset and declare that this right now is the time to detox. And we wanted to spend some time with the professional advice that you get every day from Pat, Leslie, and Steve, and go through detox and talking about why it's so important. You know, we've learned that detox happens naturally just by sweating and pooping and things like that. And you'll hear that in an upcoming Genius of Wellness podcast. Be sure to tune in about a week. But, you know, there's things that happen that, as Leslie talks about, we live in a toxic soup. Pesticides, herbicides, air pollution, heavy metal exposure, you know, chemicals in personal care products. So it really is a time to detox. The first way to detox is through nutrition. And who better to talk about this than Leslie?
Sure, great. Food is really powerful, and it's something that you can make choices about every time you sit down to eat. As Michael Pollan, a famous food writer, says, you get 3 votes a day with your fork, and you get to choose, you know, what you put in your body in terms of how it's going to impact your overall health. And sure, we all have times where especially when we're stressed or when we were going through the initial phases of COVID, where comfort food really does brings comfort and plays a role. But we thought today we would talk about how to help you get back on track. So one thing people ask me a lot is, can you kind of give me an image of what my plate should look like? It's hard for me to think about grams of this or servings. If you just had to give me one image of what my plate should look like, what would it be? So in response to that question, I show people the healthy eating plate from the Harvard School of Public Health. Because if you really look at the big nutrition studies out there that have followed tens of thousands of people over many years, not, a couple hundred people over a few months, but if you look at the big studies, most of them do point to a Mediterranean style diet. And this is kind of what the healthy eating plate represents. I don't think it's a surprise that we should be eating lots of fruits and vegetables. I think at most now it's probably common sense. Most people would agree with that. That we should have healthy protein. We don't need to be vegetarian unless we choose to, but we should weight our choices towards fish, poultry, and including beans, nuts, seeds, things like that, and limiting red meat. And also including grains. Grains have gotten a bad name, and indeed there are some people, when they have an inflammatory condition, when they have autoimmunity, when they have digestive issues, might not be able to eat grains initially. But grains are not Pop-Tarts. Grains are things like brown rice and quinoa. So I like to give that image of, if you're going to think about just eating healthy overall, whether it to be to detox or just to, reboot your health, this is a great resource in terms of thinking about what your plate would look like. And if we dug down a little bit deeper and we really wanted to talk about, are there particular foods in particular that we know that really do help with detox, I wanted to just leave you with 3 ideas. One, and they all happen to be in the vegetable group, but leafy greens. And there's a myriad of leafy greens, and this is a great time to begin going to your farmer's market. I'm really excited. Mine just opened last weekend, and the farm stand in my next town just opened. And some of the first things we see are leafy greens because they grow so quickly. So they come out early in the growing season. They're mineral rich. They're a good source of fiber, which helps clear out our bowels. And they also have something in it called chlorophyll. That's what makes plants green. And chlorophyll is actually really helpful for binding some of these toxic heavy metals that you might be exposed to just based on modern life. Also cruciferous vegetables, which have a component called sulforaphane, which really helps our liver, which is so responsible for detoxing, to kind of upregulate or increase its ability to detox. And I also mentioned broccoli sprouts because there's a few good products you can get of broccoli sprouts powder. And so if you're making smoothies, you can get some broccoli sprouts powder, add that powder mix into your smoothies, and that's really a helpful thing to detox. And I hope I don't lose everybody when I say beets, but beets is one of my favorite foods to use as to help with detox, because one, you can cook them or roast them quickly, and you can cut them up, put them in different things, but they're very helpful for really cleaning out your blood. And also they're just a good source of nutrients and antioxidants. And there's actually beetroot powder and betanin has actually been studied in terms of cancer as well. And then I wanted to give you a few quick supplement choices that are helpful for detox. One is chlorella, again, going back to chlorophyll as a heavy metal chelator. It's really a nutrient-dense superfood. And turmeric, most people have heard of curcumin. That's the phytochemical in turmeric in the ginger family that is very helpful for anti-inflammation. A lot of our patients take it, antioxidants. And just to give you the pointer, that a good way to help increase the absorption of turmeric is to put it with a fat, so adding some coconut oil or something, or olive oil, or adding black pepper. And then the last option I would suggest is just using ginger, because it's such an easy, inexpensive food to buy, and it stores well as a root in your refrigerator, or you can buy a dried powder form. And it kind of gets three major pathways of detox. It helps your digestion, it helps your circulation, and it helps you sweat. So you can just really make a tea out of it. You can, add some to a soup. I like, for example, last night I made a carrot ginger soup, and I think I've used so much ginger over time, I don't even taste it anymore. My husband took a sip of it and he was like, "Oh my God, this has so much ginger in it." And I was like, "Really? I don't even taste it." So I think you can, dial that button up over time.
That's great advice. Well, another way to detox is something that we kind of take for granted because many of us are night owls. We may get up early. We have inconsistent sleep patterns. But sleep, I never would think that it actually aids detoxifying your body. Pat, why don't you pick this up?
Well, one part is you're going to have to detoxify your brain. So we know that sleep is imperative for you to have the ability to take the toxins that come into our system. And we never thought of the brain having drainage, like the lymphatics. So people know you have lymph nodes that, I'm sick, I feel my lymph nodes swollen. And the brain has glymphatics. So the glymphatic system is like the lymphatic system. And think about your brain when you're awake and you're synthesizing noise, sound, light, vibration, children, thinking, thoughts, calculating. So your brain is like this. And then at night, it's supposed to relax and actually allow some room for the fluid that is basically kind of a car wash time for your brain. So something that I've been looking at is heart rate variability recordings, which has now been hitting every single monitor that you can see. I probably get 10 notices a day. And we had started looking at heart rate variability because this technology is quite old, and it tells us how balanced your sympathetic and parasympathetic system is. So there are a number of ways for you to actually monitor that. So my kids gave me a heart rate variability monitor so that I could become a triathlete, which I told them I did not want to be. But I go to bed and I wear this watch that tells me where my deep sleep is. And one thing I've learned is that the time I go to bed before midnight adds to my deep sleep exponentially. So if I go to bed at 11:30 or 12, even if I sleep 8 hours, even if I stay in bed till 7:30 or 8, by 2 in the afternoon I'm collapsing. And if I get into bed by 10, we want 1 hour and a half to 2.5 hours of deep sleep. I get my deep sleep in between 10 and 1, and I may fluctuate light sleep. But what's interesting is my recovery is full, even if I felt I had somewhat of an interrupted sleep. So the more we learn about sleep, the more information you have about activities. Exercise helps with your deep sleep. Getting outside helps with your deep sleep. Going to bed before midnight helps with your deep sleep.
Pat, let me ask you, true, if you don't have enough REM sleep, enough hours of REM, that you're more prone to getting a disease?
Well, it's actually deep sleep to REM. So your REM, you can kind of look at it. There's light sleep, there's light sleep, REM sleep, and deep sleep. So deep sleep is where the hippocampus and amygdala do their work of laying down memories, working on memories, restructuring your memories, and then coming out of it. I think it plays out in our REM sleep. We were in this dream state, and then we're going from delta wave back up to alpha wave, which is where we're working on I always say I wrote my best comedy at 2 a.m. I would wake up and write down my jokes, but it was my deep sleep, as I've learned, takes place between 10 and 1:30.
Very, very interesting. Another way to detox is stress relief. Steve, why don't you pick this up? How important is stress relief in terms of getting all of this toxic stuff out of our bodies?
This is probably one of the harder ones to answer because we really don't have a great unifying definition of the word stress. There are so many things that can constitute stress. There are things that are physical stresses, whether they are the toxins and toxicants that we're exposed to in our everyday life and are accumulating in our physical bodies, to emotional and psychological stresses, all of these things put our body into a state in which it's on high alert. It's in an alarm state, a fear state, or, you know, we refer to in medicine frequently as a fight or flight state. And when you are in that sympathetic fight or flight fear dominant state, your body is not able to direct its energy toward doing some things that it would like to do to kind of clean the house, to maintain proper maintenance so that, you know, you can oil up the joints again and clean out the cobwebs and all the different parts of your body that need that to be done. And so if we do not find ways of removing ourselves from a stressful state, we will not be able to adequately detox. And on top of that, it's a little bit of a circular thing in that the stress itself actually increases the toxic burden in our bodies. So it's a little bit of a twofold whammy that we get hit with. A few things I would like to draw some attention to are, one, that the physical stresses we have do not just include, you know, the diseases, the named diseases that we may carry. It does not just include the nutrient imbalances we may have from a poor diet. And it does not include just as well the ever-present nature of electronics and screens and Wi-Fi that we're constantly bombarded with and definitely has a toxic effect on us that we need to find ways of removing ourselves from periodically. But it also includes some of those emotional and traumatic things where we have bad interactions with family members that put us into a constant state of just thinking about what's been done, or negative belief patterns that we may have, you know, that may put us into states of anxiety that we don't even recognize on a subconscious level. And I do think sometimes those emotional and psychological things can actually be tracked in the physical body as well and manifest in physical ways. So in order to appropriately physically detox, you may need to address emotional things. And in order to emotionally process things, sometimes you have to address the physical challenges you may have. How do I go about doing that? Well, it's going to be different for each person depending on if I need to take a more physical detox and de-stressing approach or a more emotional de-stressing approach. But your normal functions of sleep, eating, and then breathing are fairly, you know, important. You know, so breathing is the one that is very, very overlooked. And so what I would say is when people actually say, slow down, take a deep breath, yeah, exactly. That's trying to put your body back into that not fear state, into that resting state, into that parasympathetic state. And so paying attention to your breathing, and not just how deeply you breathe, how long you take a deep breath for. Start to think about, you know, am I taking long deep breaths in? And how long am I giving to the exhale part of my breath? And just spend a few minutes actually just thinking about the quality of your breathing. That's actually one of the more important things I think you can start with for how you de-stress.
Well, that's certainly something that's often overlooked. Something that's not overlooked is activity. And we know that whether you're stressed emotionally or whether you're stressed physically, activity is important. Pat, do you want to pick this up? Because I know you're very active. You play tennis, you go for walks, you're a cook, which is also an activity. So why don't you share some ways, the importance of activity when it comes to detoxifying your life?
I still can beat my daughter at tennis. Of course, I hit her with the racket on the way down there, so the clanker in the knee. But, you know, things that get your heart rate up, being outside. If you have access to the ocean, jump in the ocean, get that salt water right up your nose. A little shout out to some saline lavage. They know that works. But de-stressing yourself, in certain countries, you get a prescription for forest bathing. In evergreen smell, you go out and you feel yourself in nature, you're grounding, you're getting the vibration of the earth, which is resetting all your molecules. So as we get better at drilling or focusing down or seeing how minutely we are sensitive to the ways of nature, the larger picture is, oh, well, that's so obvious. We've lived for thousands of years in nature, millions of years, and it's only probably in the last century that we have had to corral ourselves into a very narrow environment, farming. So I tell people, start a garden, have something to get out with. I'm going to take this call because I'm going to mute myself. We have a little issue with people trying to get
Okay. So much is made of the chemicals that are in the air, but boy, we also put it on our grass. We put this in our bodies. And we've done a lot on this in the Genius of Wellness podcast. We've done a segment on glyphosate, the chemical that's in Roundup. And I'd love for both Leslie and Steve to pick this up.
Yeah, I was just reading something recently that there's over 80,000 chemicals in the United States that are registered for use, but have never been tested by the government. We have relied upon the manufacturer of those chemicals to test them and tell us if they're safe. So that kind of raises a red flag for me in a couple of ways. But it just reminds me of how much that we're exposed to on a daily basis, from when we pick up our food and if there's pesticides on it or not, if we're walking across our grass and it's been treated in any way and things get so easily absorbed through the skin. Personal care products, the Environmental Working Group has a very good resource on their website called Skin Deep that really rates different products and what chemicals are in them and what you need to be aware of. So it's really all around us, and it's not to put fear into us, but to just be aware of that and to, keep educating yourself and trying to make better choices, because it's all around us. And, again, we just have to take it step by step and think about buying organic, think about buying locally, think about not using Roundup and pesticides on our grass, and just think about, in all aspects of our daily lives, how to make better choices.
These chemicals are not the only form of toxin or toxicant in the environment that we need to try and reduce our exposure to. But those chemicals, the way they get into our body are through what we're breathing, what we're eating, what we're drinking, and what we're putting on our skin. Those are the four main routes of entry of the chemical toxins that we have. And that's also a very similar route of entry for how some of the biotoxins that we get from molds and some of the certain types of infections that are out there from Lyme and some of the other chronic infections we get, they actually make toxins that also can contribute to exposure in some ways that we need to try and reduce our exposure to, whether it's the mold in our home or that's being generated in our bodies. And so it does take a lot of reading labels and making maybe some consumer conscious purchases of something that might be a little more expensive, a little bit more expensive soap that might be out there, but you can actually learn less expensive ways of doing those things too, if you're willing to actually make your own, for instance. And there's all sorts of resources online to help you learn those things. But the other, we mentioned some of the other toxins to try and reduce exposure to that are not just chemicals, but also the wireless and electromagnetic spectrum frequency pollution that we need to be trying to reduce our exposure to. Not only do they add a burden of toxicity themselves by increasing free radicals in our body, and that's the work of Dr. Martin Paul, if anyone's interested in researching that further. But they also prevent our body from effectively detoxing those chemicals that often come together. These things are synergistic in the way that they work. And so we do want to take a multimodal, I guess you would call it. You want to actually attack this thing from multiple angles, where you're not just focusing on, well, I'm just going to eat organic food, but I'm going to use whatever makeup I want, whether or not it's got chemicals in it or not. Or I'm going to, use my phone, put it right up against my ear. I'm going to use it in the car. I'm going to use Wi-Fi as much as possible and not turn it off when I'm sleeping. these are all things, if you focus on one without the other, you're going to have limited success in addressing your detox.
Well, you guys have done a great job in the last half hour just giving us practical advice. This is simple. It's also safe, ways to detox our bodies. This really is important for this to become a way of life. And who better than Pat, Leslie, and Steve to always be answering the call and answering the bell and encouraging us to live a healthier life. I didn't see on Leslie's plate pasta and pizza anywhere, which really, really is upsetting.
Oh,
But
no, you can sneak
I
some
think
of that in.
So
that's
no,
right. And
you
the
have
truth
to
is,
enjoy it all. There's a little Italian in everybody.
That's right.
there's a little bit more than a little in me. But the truth is that if you could take steps to get to that plate, that's an aspirational plate. Some people may already be living it. Some people it's an aspiration. But, one way to get to it is make sure that's how you shop. So, Pat, closing thoughts, just another great town hall. Thank you for your leadership in this time of crisis and for keeping all the patients informed of how Hopkins Medical is there to serve people.
So I just want to thank everyone for participating. I know there was a little snafu with our login tonight, so we'll correct those workflows. We are, a work in process. I will say that I think our world will change. This is something that we knew was coming. I mean, I think that we knew that the world of viruses and spirochetes, and we started with Lyme disease, 40, 50 years ago. And we're going to be challenged going forward. So I think everything we're talking about tonight is pertinent to every single person. Like, you have to have a plan. You cannot go on and say, it'll take care of itself. You cannot say, as some of our leaders said, this is just another flu, because that's not what it is. And I want people to get ready for our detox program, which we will be launching at the end of the month. And we're going to give you really a recipe for how you lower the burden Steve was talking about. So when you trip over that number of 65, which I did have a birthday recently. And so I every night I'm like, humic acid, chlorella, GI detox. My husband's like, what are you doing? I'm like, well, this is my final meal, which is sitting beside my bed with a jug of water and whipping my head back so I can swallow some of these tablets. But, I'd like to say that we all eat so well that we don't need it, but in fact, we can't escape it. And so we need a proactive approach to this. And Leslie and I and Steve, we're all going to be here to customize it for you. And we will be doing a 7-day detox, which I'm getting all ready for. And so that you can begin to see how clear your mind can get when you actually get rid of some of the junk in the trunk, as we say. So clean out your closets, clean out your brain. And everybody in bed tonight, 10 o'clock. So sleep well is my final. Eat well, then sleep well.
Terrific. Thank you, Pat, and thank you for tuning in, all of our viewers. We look forward to more of these sessions to keep you informed. Have a great night.
Thank you.
Thank you.